When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
This episode is brought to you by LinkedIn. Psst, healthcare pros, word's out, and it's too good to keep quiet. Look, LinkedIn is revolutionizing job hunting, making it possible to search by specialty, shift preference, and salary. Endless scrolling is out. Whether it's a mental health therapist or dental hygienist, finding the perfect role is faster and easier than ever. Head to linkedin.com/healthcare and start your search today.
Welcome to the Dr. Raj podcast. Today's episode features Everyday Rheum, a guest series hosted by Dr. Michelle Koolaee. She is a board-certified rheumatologist with a direct care practice in Pasadena, California. She trained at the University of Pennsylvania and serves as faculty and educator at Huntington Hospital, an affiliate of Cedars-Sinai. Inspired by the conversations she has with her clients every day, this series brings practical insights in rheumatology to patients and the medical community alike. And now, here's today's episode.
Hi, everybody. Welcome to Everyday Rheum, a guest series on the Dr. Raj podcast. My name is Dr. Michelle Koolaee. I'm a board-certified rheumatologist here in Pasadena. This podcast is inspired by real conversations I have with patients every day. And my goal is to bring you knowledge, support, and encouragement to help you manage your rheumatology needs with confidence. Today's episode was inspired by a conversation I had just this week with our wonderful guest, Miss Phyllis Fritz. Phyllis is a businesswoman, entrepreneur, caregiver, and an all-around amazing human. She's also a member in my practice and recently started treatment with teriparatide, also known as Forteo, for her osteoporosis. So for those who may not know, teriparatide, it's a medication that actually builds new bone. It's used in people who have a very high risk of fracture and is one of the best options that we have for severe osteoporosis. But despite its benefits, many people feel hesitant when it's recommended. And Phyllis was hesitant initially to be on this medication, and I wanted to share her story in an effort to inspire others who are in a similar situation to move forward with it if it's recommended for you. Phyllis, hi. Thank you so much for being with us here today.
Happy to do this. Yeah, I hope we can help other people be able to do this program because I'm excited about it.
Great. So before we dive into it, tell us a little bit about yourself.
Well, I've been married 60 years. I'm 78 years old. I have now sold my company that I had for a long time here in Glendora, a real estate company with an escrow company, so very busy. I'm also involved in things in the community and in my church, so I'm very active. I've got 8 grandchildren and 3 children and 8 grandchildren and a great-grandbaby now that just joined our family. So busy. Yeah. And I want to stay busy.
Stay busy, stay active. No, I love it. I love it. So what were some of the reasons that you were reluctant to go on teriparatide, Phyllis?
Once I heard about it, I was concerned about travel. How do you take something that has to stay cold and travel? You handled that wonderfully. I was concerned about injecting myself because it's not that I'm necessarily afraid of a needle, but my body reacts whenever I get a shot or have blood taken, and my body reacts adversely. I kind of go into shock rather quickly. So I was really concerned about that. And then concerned about potential reactions to it. You know, would I have a reaction? Would it hurt? Those kinds of things. So, but I was excited to hear from you that it builds bone, not just keeps it where it is. So that's an exciting thing about the teriparatide.
Yes. And I think too, that it is osteoporosis is a silent disease. So there's really no symptoms and one does not feel ill. So it is taking a medication where you're not feeling ill and then you take a medication and then you're feeling better. I think that some people that I see personally, like it's hard to move past that in feeling comfortable in working through these very valid and very normal concerns that I hear very regularly. And so, what specifically helped you to overcome these worries?
You. So, no, well, that's the answer to that, because meeting with you and having you explain it to me and so kindly actually do the first injection with me made all the difference. Your support, your emotional support and knowledge, because you educated me and then gave me emotional support to be able to do it, because I was really quite, I get high anxiety, so it was hard for me to do it. And your willingness to walk me through it and show me how, because I have a essential tremor,
Mhm.
and I don't know why it's called essential tremor, but it's what I have. And
Mhm.
so when I'm even trying to put on my mascara, my hand shakes and it's
Mhm.
difficult. And so I'm thinking, oh, gee, how am I going to do this?
Mhm.
But you showed me how to hold it. You showed me what to do. You gave me the confidence and let me do the first one with you. And that gave me the confidence to go ahead and do it. Yeah.
No, thank you for sharing that, and I'm really happy to hear that those what was working for you and what helped you move past the worries. And I would say anyone else that's in a similar situation, I think that you are your own best advocate. So I think that these are very valid concerns, and that when you're preparing to meet with your rheumatologist, make a list of these things. Like, this is why I'm nervous. I'm worried about about the tremor and all of the things that you're concerned about. You have to bring them up to your doctor, and just be prepared in that visit, so that you can get the support that you need. Because these medications, when they're recommended, they're really important. And so it's so you've been on the medication, you've been doing the injections fabulously for over a month now. And so, how has your experience with giving yourself the injections evolved? Can you tell us a little bit about that?
Well, the first couple of times I needed my husband to be there with me to make sure I was
Mhm.
doing it right. So
Mhm.
the first couple times, and then within about 3 days, he'd come in and go, "Oh, you already did it. What,
Mhm.
And
Yeah.
so I've just gotten myself in a routine,
Mhm.
and it's just now it's not difficult. And so I'm able to just do it without any stress, which is really nice. So it took 4 or 5 days for me to be able to get past, oh my goodness, what am I doing here? And
Mhm.
then I'm totally comfortable with it
Mhm.
now, which is really quite amazing actually, because yeah, I
Yeah.
didn't
Do
think
you
I could.
do you feel nervous now when you do it, or is it like it's no big deal for you?
I'm not nervous. Just
Okay.
have to get myself, I'm resigned.
I
Is
see.
the word I will
Okay.
use. I am
Okay.
resigned to do it because I want my bones to get stronger.
Yes. Tell us about your routine. So give us a visual, Phyllis.
Oh, I got my little routine that I do is you have to keep the teriparatide in the refrigerator. So I have a tray that we use to eat on, a food tray, and
Mm-hmm.
I take that and I just make sure it's clean. I actually put a clean paper towel on there. Then I set the teriparatide uh, device on there. Then I um, take out the needles and the alcohol swab, and I put it on there. So then I have everything right in one place. And I lay down in bed, kind of set up a little bit, but I just lay down in bed because then I know I'm secure. And I just have it sitting there, and I just have my little pattern there where I go through the steps and inject myself, and then that way, everything's all in one place, and I feel really comfortable. Yeah,
Okay. Okay. No, and do you do it in the morning or the evening?
I do it in the morning.
Morning. Okay. Okay.
Yep.
No, and I love the word routine, and the more automatic it becomes, then it's like you're not thinking about it. You're just doing it because you're so accustomed to that. So I think it's great that you have that.
Mm-hmm.
So, we talked about your mom's history with hip fractures, and that puts you at a higher risk yourself for fracture. How did seeing what she went through influence the way that you thought about your own bone health, Phyllis?
Watching my mother go through that, the first thing she did was break her wrist, and then that healed.
Mhm.
Then she broke a hip, and we were able to get her hip replacement and get her through that. When she broke her second hip, that then sent her in a spiral down where she just truly gave up.
Mhm.
And I stood with her while, I mean, it was not fun. It was a lot of pain when she broke her hip. And so managing that was, hard to watch my mom go through that and have that much pain. But it was harder to watch her give up when she broke the second hip. And
Mhm.
she was 82 when she passed.
Mhm.
And I think she probably, if it hadn't been for that, she would have had a much longer life. But she was happy when she died because my mother had a great faith. So she was just ready to go. She was done with the pain. She was done with having to struggle and just felt she was going to go home to be with Jesus. So she was happy. She wasn't upset about that. So she made it easy on me from that perspective. But it was still hard to watch her go through it. And I don't want to do that. So I want to work hard not to do that. Yeah.
Yeah,
Yeah.
absolutely. And I think that, and thank you for sharing that. I think it's really important to see what motivates you and what drives you to take care of your bone health in an amazing way that you are. And I
Mhm.
think that the treatments for osteoporosis, everything is to prevent fracture, everything. So,
Mhm.
I love your sharing that. I do want to mention, some people, they will prefer one of the other options that's either for osteoporosis, that's either a pill, that's alendronate. There's a yearly infusion, which is zoledronic acid or reclast. And there's an every 6-month injection, which is called Prolia, simply because of the ease of administration. And we use those treatments all the time. But what it's important to know that although those medications, they work to prevent continued loss of bone, they don't actually build up new bone like teriparatide, Forteo, or abaloparatide, Tymlos. So when your rheumatologist recommends the daily injectable like teriparatide, it's truly because you are at the highest risk for fracturing, and that's the best medication. So I just wanted to mention that because I think it's important. So back to you, Phyllis. So what else, aside from being on a great medication regimen, what are we doing together as a team to support your bone health?
Well, you have talked to me about my balance and that I need to get some help to work on that. And you've recommended someone for that. And that's a real thing because I would call it not dizzy, but very unstable. So
Mhm.
at my age and after COVID, actually. So after COVID, I had some neurological changes and I'm just unstable. And so I will pursue that and work on not falling,
Mhm.
and I won't wear my high heels. So I try to get some cute flats so I can do
Yeah.
that.
Yes.
Yeah, because I tend to want to wear cute shoes. So I will work on that. But I think that's it's your care about my total me, and not just that you are going to have me do this injection and then that's it, and but your care about my whole life makes a difference. And so and I appreciate that a lot. So I will connect with the gentleman you recommended and see what I can do about that balance.
Excellent. No, I love that. And I do think that it's emphasizing here, it's not just the medication. That's an important part of it. But it's continuing to be moving. It's doing the right types of exercises, again, that focus on mobility, balance, so that you can continue to live the active life and have the quality of life that you have at this time. So finally, Phyllis, what advice would you give to someone that is hesitant to be on teriparatide or any other daily anabolic bone building injectable for
I
osteoporosis?
would advise them to come and see you and let you help them emotionally through the stress that they're going through to think about doing it. Because I totally understand that. I mean, it was hard for me to do it, and you helped me to do it. And you don't want to have that bone fracture. You don't want to go through what my mother went through. These are things you just don't want to experience.
Mhm.
And even if not for yourself, in my case, it's not just for me, it's for my grandchildren. And I still am doing things with them and traveling with them. And two of them are now hikers, and I want to go walk with them. They know I can't hike like they do anymore, but they find, my granddaughter in Kentucky finds trails that she knows I can go on. So I go back and visit her, and she does, she's going to hike in the Alps this summer, but this fall, but she finds places where she knows I can go, and I want to be able to do that. And so I encourage anybody whose doctor's telling them they should do this, that it's not that hard once you figure it out. And once you get your routine going, it's just not that hard. And so I encourage you to do it. And if you go see Dr. Koolaee, she will help you do it. If you let her, she'll help you. And my whole family's shocked I can do it because they know me well. So, what, Mom, you're doing what? What? Are you really doing that, Mom? So, because they know how I am. So, I just encourage you to fight through that fear and make it happen so that you don't go through what my mom went through.
I think what you should have shared is just so powerful for others to hear. I really do. I think that you know your why and you're doing this again for all these different, to be able to do and engage with and stay connected with all these members of family and friends that are important to you. So no, I think that resonates with a lot of people. So thank you for sharing your experience, your journey, and just being so open with us today. And I know that this will really resonate with others who were hesitant about starting a treatment like this. So to our listeners, if you've been recommended a medication like teriparatide and you feel nervous about it, remember that you are not alone. These fears are normal, and with the right support, you can move through them. And as I mentioned before, osteoporosis, it's a silent disease, but with treatments like this, we have the powerful tools to protect your bones and your independence. So I hope today's conversation leaves you feeling supported, empowered, and with peace of mind as you navigate your own health decisions. Thank you so much for joining us today.
Thank you for listening to another episode of the Dr. Raj Podcast. If you enjoy the show, then please make sure to follow us on your favorite podcast app and leave a rating while you're there. This show is for educational and entertainment purposes only and is not intended as medical advice. This has been a production of MedPrep2Go, and you can learn more at medprep2go.com.